Got another throwing mechanism of the hand and wrist. The 6 phases of throwing are the wind up, the stride, arm cocking, arm acceleration, arm deceleration, and follow through. The anatomy, the bony anatomy starts with the radius and ulna, the carpal bones, metacarpals, and proximal phalanges, intermediate phalanges, and distal phalanges. Here's a picture of all the bone structures of the hand and wrist. These are the carpal bones, starting with the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. This is the layout of the sections of the hand and fingers. The joints of the hand and wrist start with a distal radial-ulnar joint, the intercarpal joints, carpometacarpal joints, radiocarpal joints, metacarpophalangeal joints, the proximal interphalangeal joints, which are the 2 through 5 digits, distal interphalangeal joints, which are the 2 through 5, and the interphalangeal, which is the thumb. This is a picture of the distal radial ulnar joint. It also has the articulating disc and the articulation between the radius and the carpal bones. This also shows the intercarpal joints and carpometacarpal joints and the other types. These are the different types of joints in the fingers. It includes the distal interphalangeal joint, the interphalangeal joint, proximal interphalangeal joint, metacarpophalangeal joint, and carpometacarpophalangeal joint. This is the layout of the ligaments of the fingers. Each finger has a radiocollateral ligament of the distal and proximal phalange, as well as an ulnar collateral ligament of each. And the volar plate is on the palmar side of each of those as well. These are the muscles that include for the forearm and the hand. Just a few of them. These are the extensor muscles of the forearm and the hand. It includes the extensor carpi radialis longus and brevis, extensor carpi ulnaris, extensor digitorum, extensor indicus, extensor digiti minimi, extensor pollicus longus, and extensor pollicus brevis. On the right, there's a picture of the layout of some of them. These are the flexor muscle group of the forearm and the hand. It includes the flexor digitorum superficialis, flexor digitorum profundus, flexor pollicus longus, palmaris longus, flexor carpi ulnaris, flexor digiti minimi brevis. The brachioradialis action is to flex the elbow, assist to pronate and supinate the forearm when resisted, and the nerve is radial C5 and 6. Extensor carpi radialis longus and brevis extend the wrist and abduct the wrist. It also assists to flex the elbow. The nerve is for the longest is radial C5, 6, 7, and 8, and the brevis is C6, 7, and 8. Extensor carpi ulnaris extends the wrist and adducts the wrist. The nerve is radial C6, 7, and 8. Extensor digitorum extends 2 through 5 fingers. It also assists to extend the wrist. The nerve is radial C6, 7, and 8. Extensor indicus extends the second finger and adducts the second finger. It may also assist to flex the wrist. The nerve is radial C6, 7, and 8. Flexor carpi radialis flexes the wrist and abducts the wrist. It may also assist to flex the elbow. The nerve is median C6, 7, and 8. Palmaris longus tenses the palmar fascia. It also flexes the wrist and may assist to flex the elbow. The nerve is median C6, 7, 8, and T1. Flexor carpi ulnaris flexes the wrist, adducts the wrist, and assists to flex the elbow. The nerve is ulnar C7, 8, and T1. Flexor digitorum superficialis flexes the second through fifth fingers. It also flexes the wrist. The nerve is median C7, 8, and T1. Flexor digitorum profundus flexes second through fifth fingers. It also flexes the wrist. The nerve for the first and second is median C7, 8, and T1, and third and fourth is ulnar C7, 8, and T1. Pronator teres pronates the forearm and assists to flex the elbow. The nerve is median C6 and 7. Pronator quadratus pronates the forearm. The nerve is median C7, 8, and T1. The supinator supinates the forearm. Crazy. And the nerve is radial C5, 6, and 7. Abductor pollicis longus abducts the thumb at the metacarpophalangeal joint. It also extends the thumb and adducts the thumb at the interphalangeal joint. The nerve is radial C6, 7, and 8. Extensor pollicis longus and brevis extend the thumb at the metacarpophalangeal joint. It also extends the thumb at the interphalangeal joint and abducts the wrist. The nerve is radial C6, 7, and 8. Flexor pollicis longus flexes the thumb at the metacarpophalangeal joint. It also flexes the thumb at the interphalangeal joint and assists to flex the wrist. The nerve is median C6, 7, 8, and T1. Abductor pollicis brevis abducts the thumb and assists in opposition. The nerve is median C6, 7, and 8, and T1. Flexor pollicis brevis flexes the thumb. It also assists in opposition. The nerve for the superficial head is median C6, 7, 8, and T1, and the deep head is ulnar C8 and T1. Opponens pollicis opposes the thumb at the carpometacarpal joint, and the nerve is median C6, 7, 8, and T1. Adductor pollicis adducts the thumb and assists to flex the thumb. The nerve is ulnar C8 and T1. The lumbricals of the hand extend the 2 through 5 fingers at the interphalangeal joint and flex 2 through 5 at the metacarpophalangeal joint. The nerve for second and third is median C6, 7, 8, and T1, and fourth and fifth is ulnar C7, 8, and T1. Palmar interossei adduct the thumb, second, fourth, and fifth fingers towards the third finger. It also assists to flex the thumb, second, fourth, and fifth finger at the metacarpophalangeal joint and assists to extend the thumb, second, fourth, and fifth finger at the interphalangeal joint. The nerve is ulnar C8 and T1. The hypothenar eminence consists of the flexor digiti minimi brevis, abductor digiti minimi, and opponens digiti minimi. Abductor digiti minimi abducts the fifth finger and assists in opposition towards the thumb. The nerve is C7 and 8 and T1. Flexor digiti minimi brevis flexes the fifth finger and assists in opposition towards the thumb. The nerve is ulnar C7, 8, T1. Opponens digiti minimi opposes the fifth finger at the carpometacarpal joint, and the nerve is ulnar C7, 8, and T1. The first phase of the throwing mechanism is the wind-up. For the wind-up injuries, there are very low risk at the wind-up phase. The hand and wrists are stabilized and there's not very much movement going on. The wind-up muscles include the flexor muscles to grip the ball. There's very little exertion because all you're doing is holding the ball. The wind-up movement is the movement from the static position to the balance point with the lead knee lifted. There is little movement at the hand and wrist during this phase. The second phase is the stride phase. There's also a very low chance of injury during the stride phase. The hand and wrist position is typically maintained. Stride muscles include the flexor muscles to continue maintaining the grip on the ball, pronator teres and pronator quadratus. The stride movement is the movement from the balance point to when the lead leg contacts the ground. There's slight pronation that occurs in the stride after removing the ball from the glove. You can see that in the figure B. The arm cocking phase is the third phase. Arm cocking injuries include wrist flexor and pronator muscles, which can be strained or have tendonitis from overuse. They're commonly injured through extreme valgus forces through the elbow. It can also damage the ulnar nerve. The arm cocking muscles include the wrist extensor muscles to load the ball. As you can see, the wrist is flexed backwards when he's getting ready to throw. The finger flexor muscles to maintain the grip on the ball as well. Arm cocking movement starts with the lead foot contacting the ground and ends with maximum external rotation of the shoulder during the throwing motion. There's an extreme amount of valgus forces placed on the elbow from the loading of the arm and extension of the wrist. This stretches all the extensor muscles and just elongates the whole aspect of the arm. Arm acceleration phase is the fourth phase. Arm acceleration injuries, there are low risks for the injuries of the hand and the wrist. Little movement occurs during acceleration at the hand and the wrist, but there is a lot of force to maintain the position of the hand and wrist. The arm acceleration muscles include the flexor muscles to contract and maintain the position of the hand, and the fingers extend at the release of the ball at the final point of the arm acceleration. Arm acceleration movement begins at maximum external rotation of the shoulder and ends at the ball's release. Flexion and pronation of the hand occur at 90 degrees of flexion at the shoulder, and finger extension occurs at the release of the ball. Arm deceleration is the fifth phase. There are also little to no injuries that occur at deceleration at the hand and the wrist. It's pretty stable. Wrist extension occurs. So all the wrist extensor muscles contract to slow the wrist and hand eccentrically. Pronator muscles continue to pronate the forearm, but this is also very minimal. Arm deceleration movement begins with the release of the ball and ends with the slowing of the arm through eccentric contraction. The wrist extension occurs eccentrically for deceleration. The last phase is the follow-through phase. There are little to no injuries at the follow-through. It's a slow-moving phase, and it places little risk at the hand. The follow-through muscles include all the muscles to return the body and the hand and wrist to its natural resting position. It begins after the arm is decelerated and ends with the final resting position and balance from the throwing motion. Supination occurs to bring the forearm to a resting position by the side, and fingers relax to a somewhat flexed position. Here are the resources.